Joining our medical session. Screening in pregnancy is a prenatal screening, and this is a doctor will definitely ask you to do in your first trimester to determine whether the baby is having any health. Specialist maternal and fetal medicine at Medcare hospitals. Dr. Rupa, postdoctoral fellowship in fetal medicine. Dr. Rupa.
So, generally in medicine, there are two types of tests that we can do for any individual who comes to you. The one is a screening test. The other one is a diagnostic test. So, when we use it, now when we say in pregnancy, this is a test which we can apply in any pregnant lady. So, when you apply a particular screening test, we target a particular or the unborn child, the fetus has, which is done following a result of a screening test. If test and any investigation in any individual, be it there is an option of doing a test like this, we have to tell them why you by the person who's doing the test. It is an option. You do it, you get more information out of it. They're talking about genetic abnormalities, diagnosing genetic abnormalities or finding out the risk of genetic abnormalities. They are best done in the first trimester. First trimester is the first 3 months of pregnancy. Mainly because when you get, the earlier you get the information, the better. Better planning, better decision making. You can switch on to the next level of testing. So it is always best done in the first trimester. Sometimes there are some situations when patients have missed the chance of doing it in the first trimester. In those patients, we can offer the next level of testing in the second trimester also.
Okay. And is there any...
It is always a samples taken from the mother. We don't touch the baby. It's only when these tests shows an abnormality or comes as positive for a particular baby. And we just test the baby for all these. Any pregnant lady is Pathouse and Edward numbers, and they have given a number of 1:449, which certainly is extremely alarming. Now that is exactly why I was very happy that I selected this particular topic for today's discussion. So when we're talking about Down syndrome, the first pregnancy is between 11 always comes to us. We do a scan. There's a components in her blood, that is the beta HCG. We incorporate all these values into a software. The mother's age, the measurements that we have taken, and the blood findings. And this second test is a little more advanced. It is called NIPT. The principle behind doing NIPT is the baby is growing inside the DNA of the baby, and we test that DNA. It is more precise than the first one, but it is slightly expensive, so we don't suggest it generally. We suggest it only for high risk category.
Exactly. When you say high risk, do you go through the history of...
Yes.
Okay.
Certainly. We go through the history.
Do you go through the history of...
Yes.
Okay.
Certainly. We go through the history if the mother's age is 35. So, and if there's a family history, somebody in the family has had genetic abnormalities or Down syndrome, or during the scan we feel like this baby needs a little more attention. All these people fall into the category of high-risk pregnancy.
Mm-hmm. The process of the test, is it painful?
No, it's not painful. Well, it's just there's a psychological impact, because when the obstetrician tells you, okay, you need to do this test, first you have to go for the scan. I've seen many patients you walk into, they're so stressed about it. They think, oh, it's an important scan, change their mood very fast. And then it's just a blood test from the mother, so it's not actually very painful.
So yeah, probably as you said, it's the psychology pain.
Feeling
so
that
the
we are
feeling,
going to
and
do
they're
this
worried
test,
about the results.
What if something comes out negative? And it's just that. But I think as doctors, our job is to ease that out a little. The mixed
negative.
Yes, there are some figures. They put in ratios, but the interpretation will also be given as positive and negative. If it's negative, it's fine. The pregnancy is carried on, and the general protocols of following is followed. And if it is positive, we suggest the next level of testing.
Doctor, if I may stop you here, please.
Yes.
Once it's negative, it doesn't change?
No, not really. Not really. Unless in the subsequent scans we find there is some abnormality, but those situations are very, very rare.
Such as what?
How
can the result change?
In the subsequent scan. So when I say subsequent scan, the first scan is when the baby is less than 14 weeks.
Yeah.
So let me just explain this too. It's a very good idea to do that scan, because it's not just the NT measurement. We go much beyond that, and in modern obstetrics, this NT scan is also called as a first trimester anomaly scan. So we see a lot into detail where all the major abnormalities are picked up at this particular stage. That is when the baby is less than 84 mm, 8.4 centimeters, we pick up a lot of major abnormalities. Now, if we were talking about if something abnormal turns up. So the
Yes.
next level of when we see the baby as a detailed scan will be when the mother is between 19 to 23 weeks. In that scan, if we find there is some abnormality, some structural, there's some abnormality in the brain, and then suggest different tests. Even if your screening test has come up negative,
Yeah.
based on any new finding that evolves in the subsequent scan, we may have to suggest different tests.
And what's the duration of the test? So from the time
Yes,
a mother
the
can
combined
come?
screening,
Yes.
as I told you, there is a window.
Yeah.
It is from 11 weeks to 13.6 weeks. The next one, NIPT, you can do it any time from 9 weeks onwards. Well, people usually do it before 20 weeks, and there's not much of you're not going to do much with information if you get it very late in pregnancy, isn't it?
Yeah.
It's ideally done as early as possible.
Doctor, I know parents or mothers to be, they get more worried, and they might ask, have you ever received a request to do the test again from mothers?
Always.
Really?
I have really got a lot of requests when
To run it again, to run the test
it's,
again?
It's just that I think times have changed. It's not like before. People just want to have 1, 2, 3 children, and they want their children to be very healthy.
Yeah.
There's a lot of other factors involved in raising children and everything. So the very fact that is my baby going to be normal? Will the test come out normal? Are you sure this is reliable? Are you sure the baby doesn't have genetic abnormalities? These questions keep coming up always. And that is exactly when the baby tell them, okay, if we have better test, which with better precision, but it's just that it costs a little more. If you want, we can do that too. So those are situations where we apply NIPT not just in high-risk people, even in low-risk population. After explaining to the mother, this is better than that, we give them the option of doing it. So some of them do go for it. Even if they are low risk, they do say, no, it's okay, we just want to make sure that everything is fine. I don't want to take any risk. So in those patients, we do apply, suggest NIPT, and they very willingly do it. Okay. Though it costs much more than the routine test, 4 or 5 times more than the conventional ones, people do accept it, yes.
Doctor, what is a quadruple screen pregnancy test?
Yeah, quadruple screen. For people who missed the bus in the first trimester, who did not know or did not do or just missed the chance to do the first trimester test, in the second trimester, if they want the screening done for genetic abnormalities, they can go for quadruple test. But nowadays, after NIPT has come into the picture, the importance of quadruple is really waning off, because many people who missed the first trimester screen wants to do NIPT because the sensitivity, accuracy of quadruple is much lesser than the first trimester. The first trimester combined screen is 90 to 95% sensitive. The quadruple is only 80 to 85% sensitive. We can say rounded to even to 80% sensitive. So why would somebody want to do a test which is less sensitivity? Sure. People always go for better testing.
Absolutely.
So nowadays, a quadruple is hardly done. Very few people go for it.
What's your advice for moms-to-be who are going to do the test? So how can they prepare themselves mentally?
Well, I would just say that yes, genetic abnormalities is, knowing that a baby has a genetic abnormality is not a pleasant experience, but then we all have to understand that it is not very, very common. There is a very good chance that a baby will be normal. So let's not just get stressed about it and make things difficult for yourself.
Perfect. What conditions are not screened in the test?
Well, Dalia, talking about genetic syndromes, there's a huge spectrum of it. There's such a huge spectrum of it. Something new is being added every day when it comes to syndromes and genetic abnormalities, So, the first trimester screen, which is the most commonly applied, universally applied, screens only for 3 common genetic abnormalities. And then there is NIPT, where a lot of 23 common conditions. We have to simplify it for the patients and for ourselves. Let's think about what is more common first, and when there is a need, as when we do the 20-week scan and we find abnormalities, then we can think of other syndromes and exploring and try to screen them for a particular syndrome.
You mentioned something about the age of the mother.
Yes.
For older mothers, without mentioning numbers,
Yes.
for older mothers, do they go for different tests or the same
We
test?
suggest tests like NIPT, which is more precise than the combined screen test. Most of them do go for it, yes.
TS stands for, sorry?
NIPT?
Yeah, no, the
NIPT
TS stands for? The test, the one that you said.
NIPT.
NIPT.
NIPT stands for non-invasive testing, prenatal
Okay.
testing.
Okay.
Non-invasive. That what I explained earlier is taking the baby's DNA from the mother's circulation and then doing. That's more precise because you're targeting the DNA, looking at the DNA of the baby, so that will be much more clearer and precise. And that is why mothers who become pregnant a little late, we suggest, and they belong to the category of high-risk pregnancy. So for these mothers, we give the option of these testing.
And there's an invasive test?
Well, it's positive for a particular syndrome. We give the choice of invasive testing. As its term implies, invasive testing is a needle test. You know, the baby is growing inside the mother's uterus. There's a lot of water around the baby. So one invasive testing, which is called as amniocentesis, is we put a needle into the uterus around the baby's water and we collect water. The different levels of water are taken for that particular period of gestation, and we do genetic testing on this LICA. This is amniocentesis. That is one invasive testing. The other invasive testing is taking a sample of the placenta, in very early in pregnancy, less than 14 weeks. The placenta is a structure which gives nutrition to the growing child. So we put a needle into the placenta, take a tissue, placental tissue, and do genetic evaluation for that test. So these are the two invasive testing. There's CVS, chorionic spiller sampling, and amniocentesis. That's a lot of information.
It is, absolutely.
It's difficult to digest that.
But for a mother to be coming to you, would you explain to her the...
Go into the invasive part of it and scare people, because that is something we do not have to indulge all this information in a sitting.
Okay.
But I do tell them that this is the plan. We look into the baby in detail, we take measurements, and then you can do the blood tests, and I'm sure the report will come as negative based on what I find in the scan. I can add information after the scan is over. Okay. Sometimes we get markers in scan which gives us an idea that this baby has a slightly higher risk.
Do both parents undergo tests?
No, it's just the mother. It's just the mother who undergoes all this testing. Yes.
Okay. So what happens when the result shows a problem? You said we go to level 2 testing.
Next level of testing.
Right.
So when the results shows a problem, the ideal test to do is an invasive testing. It also depends on what the results come out as positive for. It's usually and always invasive testing. That is for the chorionic villus sampling, the best test to do is less than 14 weeks. And
so for mothers to be who are expecting more than one baby, is it the same test?
It is a little challenging. Screening test is a little challenging in twins because we have two types of twins. So some tests like NIPT cannot be done in both of them. So the best test for twins in the first trimester is a combined screening.
Yeah.
Or if it is a twins which has a common placenta, we can do the NIPT. It becomes a little different. It's not just twins generally. We have to find out what type of twins the mothers carry and then advise them accordingly.
Doctor, I received a question online now saying about the invasive test.
Yes.
So back again on the twins. How do you conduct it on twins?
Twins? Okay. As I told you, if it is a twins with a single placenta, we call it monochorionic twins. We assume that both the babies have the same genes, same chromosomal pattern, so we can sample any sac or any placenta. Whereas if it is a it all depends on what type of twins you carry. Whether it is dichorionic, where the babies have two separate placentas, or it is monochorionic, let's say to sample only that particular baby. We don't have to sample the other one also.
And if, God forbid, if one showed a problem and the other one is okay?
There's nothing much that we can really do about it, but it's all about getting the information early, giving more attention to the baby, planning.
Yeah.
Sometimes when babies have some syndromes, they have a higher risk of having structural problems like heart and brain problems. Especially problems with the delivery. So we just have to plan and make sure that they get that attention. So avoiding trouble during that phase when the baby is being born and just born, avoiding trouble and complications for special babies is extra children.
Another question I received now, do I run a screening test towards the last trimester before delivery?
Abnormality. The whole idea of doing these screening tests early is to get more information early so we can plan, we can give the baby attention. Doing it.
And, would you like to share any tips to mother-to-bees, how to relax, how to chill before going to the test?
I know, it's just that you trust your doctor who suggested the test. Put on a list of, write down whatever questions you have. Stop Googling, don't check Google. Google gives us so much of unnecessary information which really gets you really worried. And you
Dr. Google.
So, Dr. Google. But they're not very common either. So you just have to follow your doctor's advice and get things done methodically and everything will be fine. All that you have to do is relax and enjoy your pregnancy.
Doctor, thank you so much for your time today.
Thank you for having me.
Thank you so much for the viewers and your questions. Wait for us for our next session. Do stay safe, wear your mask, and take care. See you.